so now we're going to introduce our speaker today, who is a Rotarian, a Boulder Rotarian, and you probably all know her because she's fabulous. So Dr. Valerie Lipetz is a doctor of internal medicine, and she's the former chief medical officer for Boulder Community Health Clinics and current BCH Board of Director member, and of course, a wonderful person. So Valerie, please take over. Daryl is going to help by doing some questions.
Yeah, and Fred, if you can go ahead and put up the slides, that would be great.
All right, great. So Dr. Lipetz, thank you so much for being here today. I mean, it's really great to actually have a medical professional walk us through everything that's been happening with vaccines. And so we do actually have a few prepared questions, and we're making this more of a question and answer FAQ type of format. There will be some opportunity after the canned questions for you to answer questions from the telephone audience, correct?
Yes, there will.
All right, excellent. Just wanted to get that straight. All right, so
Daryl, before we begin, since Mike Brady said he really didn't have any jokes for COVID, I thought I'd at least put something in. And as you all know, there's this big conspiracy theory about there being a microchip in the COVID vaccine. And I'd just like to say I love my microchip because if I have to work really late and I get lost on the way home, my dog can find me.
That's good. And I've noticed actually a black van outside of my house after receiving my Moderna vaccine. So that's great. So, I mean, most of us are aware there's a little pandemic going on, Valerie, but I think in a more focused fashion, what is the status of COVID in Colorado right now?
Yeah, Fred, can you put up the next slide? So let's first talk worldwide. There's been, over 90 million, and probably now it's more than that, 91 million cases and about 2 million deaths. In the United States, we're looking at about 4,300 deaths as of January 13th. And in Colorado, wait, that slide is wrong. It can't be 4,000. Yeah, something's wrong on there. Because in Colorado, okay, one of these is wrong, I'm sorry. The Colorado deaths is about 4,000. Obviously the US deaths is much more than that. The 400,000 US deaths. All right, and next slide. So in Colorado, this is from the Boulder County Health Department for us. In Colorado, this is a slide of the new hospital admissions by admission date. And you can see that our spike in December was even higher than our initial spike back in April, but it does look to be coming down for the most part with little spikes in between. And next slide. So Daryl asked about our vaccine.
Oh, okay, great. Sorry. Yeah, and so you can tell, all right, so just a little background for today is I got to thank Cassie Murphy and especially Dr. Lipetz because we had a cancellation in our program. So we've been putting this together for, the past, 30 minutes. All right. So, so we apologize for that. So not a lot of rehearsal time, but all right. So Valerie, we know there are 2 vaccines out on the market. I think there's 3 vaccines total that have been developed to combat COVID. And my understanding is that those are mRNA. Means it's a lot of big words. I'll let you explain here. But what does that particularly mean, an mRNA vaccine?
Yeah. So the 2 vaccines that have been released in the United States are the Pfizer vaccine and the Moderna vaccine, and those both are mRNA vaccines. Some of the other vaccines that are being released or starting to be tested for exception around the world are not mRNA vaccines. And everybody gets kind of nervous when they hear, you're messing with your RNA. But this is not a new technology. There's been work on using mRNA as a possibility for vaccines for more than 20 years. And it's really cool because a lot of the vaccines we've used before have needed to either have live vaccine in them or attenuated virus or attenuated virus. or inactivated virus. And because of that, those actually potentially are more risky than these mRNA vaccines. People freak out when they hear of mRNA. mRNA is messenger RNA, and messenger RNA is what the cells in the body use to create proteins. And because of that, they're worried that this mRNA might be able to get into your DNA and alter it forever. Well, that can't happen because these mRNA particles that we put in the vaccine do not get into the nucleus of the cell. And your DNA lives in the nucleus of the cell, so it cannot affect that. So what it does is it uses a synthetic mRNA, and it encodes a protein from the COVID virus that it then introduces into human immune cells. And it's encased in this lipid bubble. And the reason it's in a lipid bubble is so that it does not get broken down before it even gets to get into a cell. So next slide. So what the mRNA vaccine for COVID does is it gets taken into one of the immune cells, and in that cell out here in the cytoplasm, not in the nucleus, that lipid layer gets broken down and the mRNA gets released. Then that cell makes the protein that the mRNA is encoding. And for COVID virus, that's the spike protein. I know you've all seen the little spikes on the COVID virus. And then that is released and picked up by other immune cells who recognize it and then spit out antibodies, as on the top part of this slide, that then are available to fight off the vaccine. The cool thing about the mRNA vaccines is not only does it affect these regular immune cells called B cells and T cells, but also a thing called a killer T cell, which actually goes and just can eat the virus on its own. Next question, Daryl.
All right, so here's probably the $20,000 question here, Valerie. How effective are the vaccines? Are they effective?
Yeah, well, first, one of the things that people worry about with this vaccine is, didn't it get created really fast, and how do we know it's safe and all of that? So this really wasn't done as quickly as you think, because all that research on the mRNA had been done before. And then very quickly, scientists around the world started working on the COVID virus and were able to very quickly produce the map for the mRNA for that spike protein. And then that was picked up by companies that make the vaccine. Because this was such a high level of infection around the world, we had way more people that could be in the trials than we would with most vaccines, where the illness is much less prevalent. So those huge numbers, thousands and thousands and thousands of volunteers working on these vaccine trials allowed it to be tested in a much shorter time. Next slide.
Yeah, all right. Sorry. All right.
Yeah, here's the side effects compared. I hope you guys can enlarge that slide so you can see it well enough. This was one that was basically comparing the Pfizer vaccine to Shingrix, which is the new shingles vaccine that's out, flu vaccines, and then placebo. And then on the right side of this slide, you can see the Moderna has been added to that with the side effects. So the side effects are for most people relatively mild and mainly annoying. Later, I can tell you more about my experience with it. Right now, it's not scientific data, but from those of us all at BCH who've gotten our vaccines, it seems like you're less likely to have bad side effects from it if you're older, which is good news for all of us, but not for poor Daryl, who's still a baby. So, and you guys can ask questions about that as we, get to your questions.
Yeah, it's a good point too. Remember, Mike Brady pointed this out, trying to be as cool as me. Put your questions in the chat, okay? So yeah, that we can get those answered here in a moment. But so Valerie, so there's 2 vaccines currently available. Looks like there may be multiple here soon. Are people going to have a choice about what vaccine they want?
Likely no. And I think we need one more slide. Okay, you can, yeah, we'll get to that in a sec. So no, unfortunately, the way the 2 vaccines are being released here in the US is just, they come in batches, and sometimes a place that can give the vaccine will get a batch of the Pfizer, and sometimes they'll get a batch of the Moderna. As this gets to be more and more prevalent, and it's in places that may not have the ability to store the Pfizer vaccine at the super cold temperatures that it needs, the Moderna vaccine needs a little less intense cold, so it's easier to use in other places. So there may be more of the Moderna vaccine being seen out in the community. But unfortunately, because of the way the vaccine's being distributed, right now, people do not have a choice. Down the line, that's possible that people would have a choice, but certainly right now, that's not the case.
All right. And I think you're about to head down the path of this slide right here, is that this is a tough question too right now, because I know that everybody's kind of scrambling. I mean, those that are scientific and then are, probably anybody but the non-vaxxers in society are scrambling and wanting to get vaccinated. So there's probably going to be a lot of questions about this too. So this is a good question for you right now, is what is the basic firing order that people are prioritized to get the vaccines that are available now?
Okay, so unfortunately in the US, there's no standardized plan for how these vaccines get distributed. Colorado has done a pretty good job of prioritizing who goes first. The initial people getting the vaccine were frontline medical workers who actually worked with patients who have COVID. And they have been vaccinated for the most part, at least in Boulder County. The people who work in the medical field but may not have contact with actual COVID patients were the next group. And then also in Colorado, we started as much as possible offering it to people 70 and over. So, my experience obviously is mainly with how BCH has been trying to handle it. Well, actually, let's go to the next slide. So in Boulder County, not everybody can give this vaccine, and a lot of it is because of the importance of storing it properly, and not only storing it properly, but as soon as you get a batch, to get it out to people, because if it sits too long, it's no good. Not if it's in the deep freeze, but once it's thawed. So there are right now 30 enrolled providers for giving the shot in Boulder County, and that was designated by the state. And right now, 50% of those vaccines go to hospitals and large health systems. 20% are going to the federally qualified health centers like Clinica and Salud. 20% to pharmacies, which we'll talk about in a little bit, and then 10% going to the local public health agencies. So it's not available everywhere. And this, I know, has been extremely frustrating for some people who don't fall into one of those places in terms of being a patient. And stuff is happening every day to try to make it more equitable in terms of getting this out to everyone who needs one. I know that Boulder County is working very hard in trying to coordinate with the facilities in Boulder County that can give the vaccine. And it really, part of it really depends on the size of the organization, because BCH has people volunteering constantly to help give the vaccine. And what that's allowed is that right now they are vaccinating at least 600 people a day. And my understanding is that by next week, they'll probably be able to start vaccinating 1,000 people a day. Some really exciting news off the presses. For right now at Boulder Community, unfortunately, just because of how things are set up, they've only been able to offer the vaccine to people who have a primary care provider at Boulder Community Health. But as of today, they're going to open it up to anybody who has a specialist at Boulder Community Health, and even anybody who's ever had, in the last 3 years, lab work done at BCH or imaging done at BCH. Boulder County is really trying hard to make up for people who don't belong to a big medical system like BCH, but unfortunately, just recently, they did not get the vaccine supply they were told they were getting, and so they're kind of on hold again as well. Pharmacies are going to get some vaccines, but they likely, just because of the way they're set up, are probably only going to be able to do about 20 people a day, which is a drop in the hat. The big not pharmaceutical, but the big pharmacies in the area have joined up with the long-term care facilities. And those were people in that 1A, 1B category, people who live in nursing homes and assisted living situations. And they are going out and vaccinating those people in their facilities.
That's kind of what Hans Wicks is doing right now.
Yes, that's exactly what Hans Wick is doing.
Yeah, that's fantastic. So, and Valerie, I want to go off question here a little bit. I know you're going to love this. You're like, I can see you cringing. But so some of the limiting factors, let me see if I got this straight, is it's obviously the availability of the vaccine. My understanding is also there's some supply chain issues with things like, needles and syringes now. How much is that impacting the effort? Do you know?
Yeah, that is starting to impact it. So far, we've been lucky in Boulder County, and that has not been a big issue for us, but certainly across the country, there's concerns about that. And yeah, all these things can end up just being another factor that can make it really difficult to get this. Some of the areas across the country are doing some pretty cool things with drive-up vaccine, where you drive up, you get your vaccine, they stick a card on your windshield that says how long you have to sit in the parking lot in your car to make sure nothing happens to you. Because we do want everybody who gets the vaccine to sit for about 15 minutes after that vaccine to make sure they don't demonstrate any side effects that are acute ones that need care right away. And anybody who's had a history of anaphylaxis needs to be watched for like a half hour. So anyway, they can do that. And then when their little card time comes up, then they're allowed to leave. So that may happen somewhere in Boulder County, just like we did with at Stasio Fields doing the testing there. But until we have enough of the vaccine available to those people who can do that, and until we have enough volunteers who are trained to give the vaccine, it may be, another month or so before that really can gear up.
Right, because people still need to be operating with their scope of their license too. We can't just have everybody doing it. And just to clarify, even at these drive-up ones, I mean, it's only an arm vaccination, okay? That was kind of a joke, right? So,
I guess you could moon the provider and get it, but no.
Yeah, all right. So,
okay.
All right. So moving on here, lest we digress, all right. So you partially answered this just because of the supply chain, but I think everybody's going to want to know, where can I get the vaccine? Did you thoroughly answer that? Do you have some more on that?
Well, that's the big sticking point. I mean, right now in Boulder County, Boulder Community Health has been able to do a lot, but as I said, if you're not a patient at Boulder Community Health, it's been frustrating. If you have a primary care provider who is in Boulder, but not part of Boulder Community Health, it can be harder. I know Centura is trying to do what they can. Clinica and Salud and has really been working hard on trying to make it available to people, to all people, but they don't have as many. And my understanding was we had one of our people try to call there just to see, and they were told that there was a 2-hour wait on the phone before you could even talk to somebody about it. So it's not going as smoothly as anyone hoped. it's going very smoothly in some places, like, you know, at Boulder Community Health, it is going smoothly, but it's still not reaching out to as many people in the county as we are hoping to. Boulder Community was able to reach out to first responders, and they vaccinated Boulder Police Department, and I believe the ambulance folks have been vaccinated as well.
Yeah, AMR. Do you have a couple slides? I think, Fred, I think there's a couple slides here on, let's see, the numbers. There we go. Yeah.
Here's how it's going in Boulder County, and this is from Boulder County. They supplied this slide. So you can see it's kind of been up and down, but we are starting to make progress with more and more people being vaccinated. On this slide, you can see there's a big drop off on weekends. Some places that can do it all weekend, like Boulder Community Health, does not drop off over the weekend. And next slide. Oh, okay.
Oh, I think I missed a question here too. Sorry, I'm new to this. So how much is it going to cost me to get vaccinated?
This is the coolest part. The vaccine is free. Now, that's not to say that some providers may have an administration fee, but so far, everybody's giving it free around, that I know of, around in Boulder County. Great.
All right, I got a couple more questions here. My understanding is the phone is ringing off the hook with questions from the studio audience. So we'll get to those here in just a minute. But all right, so there's 2 doses of vaccine, and you know, I think, you know, like in the UK, they've been talking about you know, giving only 1 dose, and so I wanted to get your opinion about how important is that we get both doses of the vaccine, whether it's the Pfizer or the Moderna.
Yeah, right now it seems to be really important to get both doses, because when you're first exposed to a vaccine, remember when you were a kid and you had to get like 3 polio shots and 3 of your tetanus shots, and that it's because the body does not start to produce enough immune antibodies to things until it's seen it a couple of times. So the first vaccine does get you some immunity, but if you'd never got the second vaccine, you'd only have about 50% immunity to the virus, whereas then getting the second dose with the Pfizer and the Moderna anyway bumps you up to 95%. One of the vaccines coming out, which I think is Johnson & Johnson's vaccine, says they only need 1 dose, but we'll have to see how that goes. So right now with the Pfizer vaccine, you have to wait and get a second dose 3 weeks later. And with Moderna, you have to wait and get a second dose 4 weeks later.
Okay. And then it's kind of interesting. It almost seems a little counterintuitive here, but even after we're vaccinated and you've got the second vaccine dose on board, we're being told wear masks, keep social distancing, and stay safe with all of the precautions that we're under right now. What's your opinion on that, and why is that, I guess?
Yeah, right now that's because we still don't have enough data about how effective the vaccines are. I mean, they're effective in preventing the person who had the vaccine from getting COVID, but what we don't know yet is how effective they are in making sure that we still can't be a spreader of virus if we've been exposed. And so that's why they're still recommending masking and distancing. Plus, there's going to be a lot of people who don't get the vaccine. And so it's still important to protect everybody by wearing the mask. And nobody knows how long that's going to happen for. It really depends on how many people get vaccinated. And you've all heard the term herd immunity. You know, that takes probably about 70% of the population getting vaccinated to really start to have an effect. So it may be 9 months, it could be another year that we're still going to need to mask and social distance, which is very sad and makes everybody go, well, whoa, what good is that vaccine if I'm still stuck at home?
Well, and I think those are great points too. And I guess, kind of reminds me of what's been happening like with measles. And then, of course, the high prevalence of anti-vaxxers here in Boulder County, which has caused an uptick in pertussis, which is whooping cough, of course, and, the fear of, future polio outbreaks. And so I think it's really the responsibility, and this is my opinion, that we all have a duty actually to kind of fracture some of these myths and really promote, getting the herd immunized for such a, thing. But all right, so those are our canned questions, and I appreciate that, Dr. Lipetz. And so we're going to go to the phones here. Again, we got lots of questions. They're pretty good ones. And we're going to start out with Bill Rubin. Mr. Rubin.
Hey, how's everybody doing? So my question has to do with the new COVID strain was just reported in Colorado in the last few days.
Mhm.
And should we be restricting our activities in new ways? So do I still go to the grocery store, or not, that sort of thing?
Right. Well, that's a tough one, Bill, because it is more virulent, but so far it looks as though if you continue the usual precautions of masking, washing your hands a lot, you're probably not going to end up with that virulent strain. And the other good news is that those new virulent strains have the same spike protein. So we have every reason to believe that the vaccine is efficacious against those new strains.
And so I'll throw in the follow-up question. So do we know anything about the vaccines and just how effective they'd be with the new virulent strains, Dr. Lipetz?
Well, no, because the new virulent strains are new, but if they have, and the thought is they have that identical spike protein, so because of that, it should be just as effective with those virulent streams
Okay, fair enough.
as it is with the one that was around when they made the vaccine.
Right. And I really got to apologize here because I think my list is wrong. John Kotke actually had a question. He should have been first. John?
Actually,
it's my question.
Actually, it's Lena's question. Yeah.
So it'll be a better question then.
But I just wanted to say hi to Valerie anyway. So.
Hey, John, I'm sorry because you usually get to ask the first question. So I'm really but your beautiful wife asked really good.
Well, you
questions.
actually addressed the issue that I was going to ask about, which is the issue of the ability of us to spread the virus after we've been vaccinated. I'm wondering if you know what kind of research is being done on that question and when we might know whether or not we can still spread the virus.
Yeah. I really can only answer that by saying I know there's research being done on it, and part of it is obviously having a large enough cohort of people who've been vaccinated to be able to actually continually swab certain people and see if they, are still carrying the whole vaccine in a way that would be able to spread it. So
do you have to be registered? Do you have to be registered in a study to be part of that, or so that's not going to happen automatically? Okay.
Correct.
Thank you.
All right. So it looks like our next caller coming to you from Costa Rica, Bill Anderson.
Hi, Valerie. Thank you so much for speaking with us today. I just had a quick question. I understand what you said about 50% and 95% and the importance of getting both doses of the vaccine. I guess my question is, there's been talk of trying to use all of the vaccine to get those first doses in, and then as the second doses come, give those second doses. What's the state of that decision-making at this point?
Yeah, a lot of that is still being worked out logistically in terms of, how many vaccines do we really have? How many are we really going to get? And I know they're really gearing up the process to create it. So if there's shortages, yes, we may come to that point where we have to do it that way. And if we have to do it that way, there's lots of research that shows that at least even if you have to wait 90 days to get the second vaccine would still produce the antibodies it needs to. And obviously, if we're going to have those gaps where people are only, 50% covered, that's even more reason to continue all the masking and social distancing and things like that. And I just want to say to you, Bill, I'm really jealous because I'm here in my shawl because I'm freezing to death in my house and you're there looking all summery.
Back in 2 weeks.
Okay.
Yeah, well, if you want to do maybe Airbnb swap. Why don't you get a hold of Sally and I, okay? And yeah, so all right, next question comes to us from Mr. Gordon Gamm. Gordon. Gordon, you're probably muted still because we can't hear you.
Yeah,
There you go.
understanding is that Governor Polis indicated just recently that only 38% of the vaccines were delivered that were expected. And I was wondering how that's going to affect the distribution and the priorities and the appointments that have already been made.
Well, that is going to end up affecting it. I know that I don't know if you heard earlier, Gordon, that I mentioned that Boulder County just did a release that they had a lot of people scheduled that they're not going to be able to give it to because they did not receive their vaccine. So, you know, it's going to be different day to day, finding out, you know, who has it and who's able to give it. And you may get an invitation and sign up for a vaccine and then find out that it's going to be delayed because the delivery didn't happen. And my hope is that as things gear up with the new administration, that there'll be a better supply chain, but I can't promise that.
If we've already had a vaccination and are scheduled for a second one, is there a chance that we won't get the second one?
Well, as far as I know, most of the places where we're giving the vaccine, you're pretty safe being able to get that second one. It would take kind of a disastrous event of total destruction of the supply chain for a while to not be able to get it. But as I said, if that happens, you know, and then the supply chain comes up again, certainly you would be a priority person to get that second vaccine. And as I said, as long as it's, right now, we know that as long as it's within 90 days, it should be just as effective. So hopefully there won't be any delays for people who've already had their first vaccine in Boulder County, but we'll have to see.
Yeah, and Valerie, now that's actually a great question. I want to go down that path for just a second here. So I've got my first Moderna dose, and so is there one being saved somewhere for me as my second dose, or how does that work? Because it's the same question asked a little bit differently.
Right. So far, my understanding is they're trying to make sure there's enough doses, but it's not really saved. You know, this is Daryl Brown's second dose. So there is a chance that something could happen, but right now it seems to be going very smoothly and people are getting their second doses.
Okay, thank you. All right, and then our guest, Wahab, you have a question. Somebody actually put it in here for me to say, oui, Wahab está la próxima person por donar une question.
Yes, Wahab, une question à poser. Thank you for the invite, first of all, and thank you for your talk. I really appreciate it. My question is regarding the distribution and the storage. If the vaccine goes and loses the temperature requirement of -70°C, what happens then? Is the vaccine discarded? And if so, what happened to the distribution and what happened to the people that are still waiting?
Yeah, so I only know of this kind of 18th hand from other places in the country. What they try to do is if something happens, they just try to like vaccinate everybody they can, you know, because if you do it quickly, it doesn't lose its efficacy. And then again, the Moderna vaccine does not need to be kept quite as cold as the Pfizer. So it's a little less likely that that's going to happen to the Moderna. But my understanding is that there have been some places in the country where they've had to throw out the vaccine, which is horrifying. But other places have just like somehow managed to just like bring people in just kind of off the street who want it and vaccinate them just so they don't go to waste. But we're hoping that that happens extremely rarely and doesn't end up being a big part of this.
Right. Well, that's kind of interesting. It kind of reminds me of that one scene in the movie The Jerk where I would like fresh wine. I would like a fresh vaccine, please. Okay, John Rieger, you're up with our next question.
So while we're faced with the challenges of this pandemic, life goes on. If I have an accident and have to go to the emergency room, should I be concerned?
No, John, you shouldn't. It's been amazing at the hospitals, what a great job they've done with keeping people safe who need to come to the emergency room for other reasons. Anybody who is suspected of COVID is isolated away from other patients. All of the providers in the ER are in full PPE if necessary, and cleaning. So you are safe, my dear.
Right. Yeah. And yeah, I can personally vouch for that. It's actually pretty efficient how it's being run right now, at least at BCH. And so Nancy Chin Wagner, you're coming to us with the next question and selfie.
Okay. Hi, Valerie. Thank you so much for doing this. This is good information, even though I'm not in Colorado. So can I do like 2 questions, 3?
2.
No.
2. Okay. All right. Well, for this, Colorado's probably really good setting this all up and everything and how you're doing things versus Las Vegas. So we won't even go there. The next appointment is not even coming up until February. So my question to you is, since everyone is taking these, the vaccines and stuff, is everyone who's taking it, eventually their name's going to be on some kind of national register so you know that we've taken it, so that when we get to a point where we can travel, that hopefully, like, you know, those departments can just look at them and say, oh yeah, they got it, so they're okay to travel, or,
Yeah.
you know, and all that.
Yeah, Nancy, I have no idea how they're going to handle that, but I can tell you that when one has been given the vaccine, you do have a card that has your 2 doses on it. And whether that's going to be the thing that you're going to end up showing when you travel, or whether anybody's going to care whether you had the vaccine or not, I mean, it's really not clear. So we'll have to see. I mean, that one's down the line. First, we have to get people vaccinated, and then we can worry about travel and get John back on his boat.
That's right. All right, thank you. That's fine.
Yeah, and they are issuing the
Nancy.
card, and it
Thank you.
shows, you know, the first dose, second dose, what lot number, all that. And it kind of reminds me of like, I had, you know, with my travels to Kenya and Sally's, we had to have our yellow fever card, and you had to present that. Now it's probably the least of the worries, yellow fever. So Anne Marie Reeder, you have the next question.
Thanks, Daryl. Thank you, Daryl and Valerie, for a very informative presentation this morning. So my question is, I've heard some news reports that a significant number of healthcare providers, workers, are refusing to get the vaccine. And I was wondering, I was very surprised and shocked at that. And I was wondering if you had any thoughts as to why.
Yeah, I mean, it breaks my heart to tell you the truth, Anne Marie, but I think it's that some people are like, well, I don't want to be the first one. I want to see what happens to everybody else who gets them. And then, you know, as Daryl mentioned before, at least here in Boulder County, we do have a lot of people who are pretty anti-vaccine of any kind. So that, I mean, it's people just worry, and they don't want to be the first, and they want to make sure all of the people who get it are doing fine and healthy. And it's sad. I mean, I wish they would get it, but that's, you know, people have their individual ideas about, you know, what's good for them, and you can't necessarily change minds all the time.
Is there, can I say one question too? Is there a concern that we're not going to get to herd immunity, that there's going to be a critical mass of people who won't get the vaccine?
Well, over the entire US, absolutely. Because when they started, you know, when they started with the vaccine, they did a lot of questioning about, you know, would you get the vaccine if it was available to you? And, you know, the most a lot of places saw was 50%. So no, that doesn't really get us to herd immunity. So I think, you know, as long as people see that Daryl and I are not growing horns out of our heads, and, you know, that we're still acting normally, I'm hoping people, even if they were hesitant initially to get it, will start to come around. But this country, especially because we don't have the same community mindedness that I think other countries have all the time, it could be a struggle.
Yeah, and I just want to reinforce what Valerie had stated earlier is that the amount of people in these clinical trials, it was huge because of the amount of people infected. And so when the virus, it wasn't rushed through, it followed the same FDA process and the number of participants and everything else. And so it's because we had more people to test it on, right, Valerie?
Right.
Okay. All right. Marianne Jaros is our next question for you, Valerie.
Hi, Valerie. Thank you so much for doing this for us. It's been very informative. My question was, what about secondary and tertiary medical care providers such as massage therapists and people who don't work in a hospital setting?
Well, the hope was that they and dentists and other people like that would be able to get the vaccine through their counties. And that's why we're kind of sad that there's been this delay, but that will happen. Just how it's going to happen isn't clear. Now, obviously, a lot of those tertiary people have, go to doctors who maybe are able to get them the vaccine. So those people will be covered. But I think we're trying, as I said, to get kind of a consortium of the county with the places that are receiving the vaccine and able to get the vaccine to try to open things up more to those folks.
Thank you.
Yeah, well, good questions, good answers. So we'll probably have time for just one more. We'll try and squeeze in two, but Jim Narodowski.
Oh, Valerie, thanks so much for doing this. Quick question. Based on the numbers that you shared, it looks like about 15,000 people in the county have gotten the vaccine in the last 6 weeks. So if there are like 340,000 people in the county, I know that it's going to start happening more quickly going forward, but I mean, could this take 10 months or more?
I think it's going to go more quickly. We're hoping to get to the general population by summer. But again, that's as long as there's no bad thing that happens to the supply chain. Boulder community, as I said, is doing 600 a day, and by next week we'll be doing 1,000 a day. So I'm hoping other places can, if we come up with these either drive-through or, tents outside or whatever, that we can bring in more of the population to other places and get it going a bit more rapidly.
All right, thank you.
All right, so we got time for one final question.
Yeah, Nancy was like waving her hand, Daryl. I think Jancy Campbell.
Well, okay, well,
I on there, no?
Yeah, so I got to go with what I was given here, just following protocol. It's kind of like we have to follow what the state is telling us in terms of who to vaccinate, okay? It's the four-way test. So George Russell, you got the last question, so make it a good one, all right? Make us proud. George, are you there?
Not Susan.
Yes. I was wondering if you get the vaccination and during the period between that and the second and in between the time, and you have to go through surgery or any kind of thing, is there any problem with any of that?
No. No, you should be absolutely fine. We are asking people if you're supposed to get some other immunization, that you wait at least 2 weeks on either side of your COVID vaccine. Here's a question I think is important. If you get COVID in between the two, you have to go through your usual 10-day whatever of being isolated, et cetera, and then it's usually recommended then to wait at least 2 weeks after that to get your second COVID shot. Really sick people who've had COVID are supposed to wait 90 days until their COVID shot. So, but if you have to have surgery or something like that, George, you're at absolutely no risk, after having had the first one. From the vaccine, let me put it that way. Yes, your surgery could put you at more risk.
Right. All right. Wow, that was amazing. And so another doctor, Dr. George Garmany, Mr. Dr. Bowtie, you have something to say to Dr. Lipetz.
You bet. Valerie, as you know, Rotary gets the last word here, and but we really want to thank you so much for your presentation. There are 2 or 3 aspects of the presentation I really want to focus on. Your lucid description of the mRNA technology, vaccines, and so forth was so effective that I think it should be labeled in the future as the Lucid Lipetz lipid layer presentation. Bravo, well done. And these mRNA vaccines really seem to be a preview of a true scientific breakthrough. And it's going to be relevant to many other medical developments over the next few years. So that preview that you've given us will have lasting benefits, kind of like a vaccine. But most importantly, you have shown us, as you can do so effectively, that there's much more to medicine than algorithms and computerized data. There's a human element that you bring to it, and you do such a good job of that. As you know so well, Rotary International has been working in the vaccine field for years in the form of our long-term project to eradicate polio. Therefore, Boulder Rotary Club will donate in your honor 100 doses of the polio vaccine. Thanks again, Valerie.
Yay. Thank you.
And here's my card. I've been down and had shot number 1. I'm
Right.
the Pfizer thing.
So Cassidy knows it was all about me getting to get the 100 doses of polio. So thank you so much.
Thank you, Valerie. Thank you, George. And thank you, Daryl. It was a great presentation.